So we don't have all the answers about the coronavirus, obviously. We're giving you the best medical advice that we can know. Dr. Daria Long is with us. She's a clinical assistant professor at the University of Tennessee and an emergency room doctor. Dr. Daria, it's so good to see you. I know that you've been working in the ER for the past couple of days. First of all, what are you seeing there?
Hi, Christy. Good morning. And yes, you're right. I just worked in the ER the last 2 days. And what really became clear to me, and what I've seen amongst all my ER colleagues across the nation, is one, that we really don't have surge capacity for a lot of additional people to be getting ill. And number two, we do not have that testing capacity. Christy, for me to get testing, and this is the case for most physicians across the nation, to get a patient tested, you have to jump through many hoops, make several phone calls just to get patients tested, because we don't have enough. We're really rationing those tests. It's really difficult to get someone tested right now.
Well, and I'm seeing a lot of people online on Twitter and Facebook getting a hold of me and saying, I've got asthma, I've got diabetes, type 1 or type 2 diabetes. My daughter, one woman has rheumatoid arthritis, and her daughter, who's 25 years old, is afraid to come see her because she doesn't want to get her sick. Talk to me about the two populations you mentioned when it comes to COVID, because I know you're talking about people who are compromised.
Yes, Christy, that's exactly right. This is really a tale of two different populations. There's the first population that we call really the medically fragile. So those are people who are 70 or 80 or above. It's people who have chronic medical conditions. That includes asthma or poorly controlled diabetes. Because what we're seeing, the death rate of people infected in somebody, for instance, who is 80 or above is 14.8%. Now, for that group, it is a medical crisis. Now, contrast that to the majority of us who are otherwise well. For instance, in somebody who's 40 or below, the death rate is 0.2%. So for the rest of us, this is a logistical crisis and a logistical challenge.
Before I get to those questions, I do have the questions that are coming to us online. I want to ask you one more thing. Is it plausible that the coronavirus will be similar to the flu in regards to its seasonality, meaning like the flu, we just come to expect that in the spring or in the fall, this is what we're going to see, and hopefully we'll have a vaccine soon for it?
Right. There's two questions there. One is, will it abate when it gets warm? We hope so. We don't know. So we cannot rely on that when we're making policy decisions. And it is possible that this will start to come around every year with a seasonality to it. Again, we don't know. And yes, we hope there'll be a vaccine by that point.
Yeah. Okay. Listen, I first want to get to this question here. Should we be, this was a great question, should we be wiping down our non-perishable items from the grocery store when we bring them home?
So what non-perishable items you can still find, we won't even talk about toilet paper right now, Christy.
Yeah, I know.
But what they talk about, and when you're wiping, I want people to be using an EPA-approved disinfectant, but you should not use those on anything that may be touching food or on food. So I would not use it on things like that. But otherwise, if you're nervous, especially if you have somebody who's medically fragile in the home and it's not something that's a food surface, it's not necessarily a bad idea.
Okay, so the next question, how do you know you haven't already had COVID-19 if you've been sick? Do you carry it afterwards?
So you are initially, and this is very important, you're most contagious right when you get the symptoms, and then for a few days afterwards. Right now, we don't have a test to tell you if you've developed the antibodies for COVID at this point. I think it's safe to assume a lot of people have probably had it and may have gotten better already, but there's not a way to know if you did get it and have recovered.
Okay, so then this person asked, this is one of them I was talking about, how much does asthma affect the risk of complications if you get coronavirus, and what can you do to minimize them? And does it make, I mean, there are a lot of kids who have asthma, and we know that they haven't been in this category to be at high risk.
Yes. So fortunately, in children under 9, we have not seen any fatalities reported yet. But again, a child who has asthma, especially if there's some of those children, I see them in the emergency department who have to come in a lot because they have poorly controlled asthma. I would group them in the medically fragile group, in that you want to kind of keep them isolated and a little bit more careful with them.
Okay, and lastly, as a hairstylist in Virginia Beach, I'm in contact with many clients, and I'm curious as to what we can do to help diminish my risk. We've talked about the hand washing and the social distancing, but as a hairdresser, you can only be so far away from your clients.
Yeah, you're very close to your clients. Yes, I'd say social distancing as much as possible. If you have a client, any clients who are sick or having symptoms, probably tell them not to come in. Want them to wear a mask. Be very careful there, and especially washing your hands is going to be very important. And Christy, I do want to say one thing, if I can. We're talking about the two populations, the medically fragile and those who are not medically fragile. Right now, we have this shortage of tests. If you are in that group that is healthy, you are not feeling especially sick, don't just come into the emergency department. Don't just show up at your doctor's office. We probably won't be able to test you. But there is a number you can call the Department of Public Health or call your doctor's office, 1-866-PUB-HLTH. Call them first, and they'll be able to direct you, because we don't need swarms of people going to the emergency department right now.
And a very good reminder to call your doctor's office before you go, because the doctor's office needs to be prepared for somebody who thinks they might have it, to make sure that it doesn't go around the office. Dr. Daria Long, we so appreciate you. Thank you.
Thank you, Christy. Have a great day. Stay well.
You as well. You as well. And if you have questions or concerned about the coronavirus, we want to help you get them answered. We want to thank everybody who's tweeted us and gotten a hold of us on Facebook and Instagram already. But you can tweet us at Victor Blackwell and at Christy_Paul. Use the hashtag NewDayWeekend and tell us how the outbreak's affecting your life. You can also ask our medical team. And for that, go to cnn.com/coronavirus-questions.
A lot of valuable answers there that are tailored to people's lives, especially that hairstylist, which I didn't think about.
Yeah.
You have to be close.
Yeah.